Bonjour, good morning. My name is Isabelle Guyon. This brief presentation introduces the various aspects of my current research related to causality. I'm a professor of machine learning and AI at Université Paris-Saclay and a recipient of an AI chair from the French agency of research ANR called Human AI, whose charter is to democratize artificial intelligence. I was also a recipient this year of the BBVA Foundation Frontiers of Research Award for my work on support vector machines and my work on organizing AI competitions using the open source Codala platform is currently funded by the EIT EU project and the Paris region. Causal models aim at capturing the functioning of physical, biological, or sociological systems to a level of complexity permitting to predict the outcome of interventions of interest, like government policies during COVID, but not to a greater level of complexity. Generally, they consist of a graph connecting together macroscopic variables, and they can be used, for example, in macroeconomy. Causal models differ from other types of models in that they capture which variable influences which other variable, as opposed to modeling simply correlation or statistical dependencies. This makes a difference when you start kicking the systems in a way that they have not been exposed to before. This is called predicting the results of experiments or interventions. There are surprisingly many situations like that because models are often trained with data collected in given conditions, for example in a lab, then deployed in different conditions, for example in the real world. There are many facets of causal modeling which have implications in science and industry, which I'm interested in. Causal discovery, causal inference, and causal analysis. Causal discovery's goal is to unravel cause-effect relationships between variables, events, and/or objects, hence to create a causal graph using observations or experiments. On one hand, observations are generally cheaper and easier to obtain than experiments, as data are routinely collected, but they're not as reliable to infer causal relationships because they are more revealing of correlations than causation. On the other hand, experiments, also referred to in the industry as A/B testing, may be infeasible or unethical. For example, removing the moon to see whether it influences the tides is infeasible. Forcing people to smoke to see whether it increases the risk of COVID-19 is unethical. So it is desirable to make the most of observational data as possible. Causal discovery includes a problem of particular practical interest, that of discovering immediate causes affecting a particular outcome. This generalizes the problem of feature selection. Examples of such problems are encountered in the biomedical domain and include distinguishing symptoms or consequences of a disease from their causes for prevention or cure purposes. For instance, coughing is a symptom of COVID-19, while a coronavirus is the cause. Suppressing the cough alleviates the symptoms, but does not cure. However, effective antiviral medicines will hopefully soon be available to cure the disease. I have conducted work on these subjects since 2007 with colleagues at Carnegie Mellon and elsewhere. We started together the CAUSALITY Workbench project to benchmark causal discovery algorithms, and this work was published in several books. Divyan Kalanaitan, a doctoral student whom I co-advised with Michel Sebag, gave a try to this problem with deep learning methods and put together a nice causal discovery toolbox, which includes state-of-the-art methods. This work was done in collaboration with Olivier Goudet, a postdoc in our lab at the time and now professor in Angers, and David Lopez-Paz from Facebook Paris. Causal inference is a different problem. In a variety of applications, the causal direction is known. For example, we know that treating a patient with a given drug will affect his health status. So in this case, we have the structure of the causal graph to start with. The question of interest is to evaluate the total effect of a given treatment on a particular outcome. Treatment is taken in a broad sense. It's not necessarily a medical treatment. It can be an agricultural or industrial method or a socio-economic policy, for instance. Causal inference is not as easy as it may look if we want to do it from inexpensive and easily available observational data. This is because the system may include many variables, some of which are observed and others are not. The estimation of effect may be biased if some variables are omitted. In social sciences and medicine, variables that may cause such a bias are called confounders. For example, imagine that you want to assess whether using sunscreen increases the risk of skin cancer. Since sun exposure causes both putting on sunscreen and increases the risk of skin cancer, it can be a confounding factor. If this factor is unknown or ignored, the estimation of the influence of putting on sunscreen on skin cancer will be over-evaluated. In this context, recent progress has been made by Judea Pearl and collaborators by putting together an operational method called the backdoor criterion. With this method, a proper conditioning set, or a set of variables that need to be taken into account to debias estimation, can be identified to carry out causal inference, provided that all potential confounders are included in the observation. So our doctoral student, Divyan Kalanathan, and his colleague Olivier Goudet and David Lopez-Paz have produced a modeling tool called CGNN for Causal Generative Neural Network, which is applicable to causal inference. There is a growing amount of research which assesses building proxies or fast neural network predictors which can substitute slow simulators or solvers. Another application of generative neural models is to protect data privacy by allowing to produce data indistinguishable from real data without revealing actual data pertaining to a particular real individual. Work on privacy-preserving synthetic data is presently conducted with Christine Bennett at RPI, New York. The idea is to train a generative model in a secure sandbox using sensitive private data, then exporting the model outside the secure environment to generate synthetic data, which retains the utility of the original data without compromising privacy. Without an understanding of causal modeling, mistakes are easily made in designing such models, ignoring the need to test them outside of their range of normal use, for instance. Other doctoral students that I've been working with, Victor Estrade, Benjamin Donneau, Balthazar Donon, and Jiangying Liu, have been working on deep learning method that can be used for debiasing. That is to get rid of the effect of confounders on nuisance variables or systematic bias. While such models are still under development and need much more testing before being deployed, they target an important problem and promise to have a wide array of potential applications. Several ideas have been explored, including finding data representations that are immune to confounding factors and finding models which allow performing counterfactual analysis. For example, imagine that you want to make hiring decisions based on anonymized CVs deprived of their gender, age, and origin information. Some implicit information about gender, age, or origin may still be present in the CV and consciously or unconsciously affect decisions. For instance, the language spoken or the hobbies could be revealing. One method is to train a model to predict hiring decisions while untraining to predict gender, age, or origin. This is the approach that was taken originally by Ghana and collaborator in their work on domain adversarial neural network, which learns internal representations deprived of bias. This method, however, does not work if the features of interest to make hiring decisions are also predictive of the nuisance variables. For example, language spoken may reveal origin and is a possible source of biased decisions. But at the same time, It may be useful to predict the professional skill needed for making hiring decisions. So another deep network method called LeapNet, invented by my students in another context, can be used to take bias into account in such a case. By injecting the confounding factor in the inner layer of the neural network, the network learns to modulate the relationship between treatment and outcome according to the magnitude of the confounder. At utilization time, anonymized CVs can be coupled with counterfactual values of gender, age, and origin to see whether this aspect affects decisions. For example, a CV of a female person can be coupled with a male input to see whether decisions are affected. Decisions can then be averaged over all values of the confounding factors. The last facet of my research on causality is causal analysis. It concerns the qualitative understanding of cause-effect relationships to provide guidelines for the design of experiments to collect and pre-process data. In many ways, I believe that this is the most important aspect of my work because insight is often what is most needed in design. And models that end up being deployed are rarely as simple as causal graphs. Causal analysis starts at the data collection level. Clearly, there is no good modeling without good data. Since observational data are cheap, why not collect good observational data? What this means is to collect enough covariates, variables that should be unrelated to your problem, but could end up being confounding variables or reveal experimental artifacts. In medicine, practitioners always collect age, sex, ethnicity, and other such potential confounding factors. In biology, one commonly records temperature, humidity, name of the operator, and other such potential confounding factors. The causal graph community has come up with an array of designs to improve on building models using observational data, including the use of instrument variables. Such variables are very precious as they allow to perform a kind of randomization without performing costly randomized controlled trials. Another qualitative analysis involving causal reasoning concerns the treatment of missing values. With Julie Joss and other co-authors, we have written a paper which explains that missing value imputation can be more harmful than useful, depending on the causal relationship between variables. Imputation can reverse the causal arrow and yield false positive dependencies between a feature of interest S and a target variable T when using a helper variable H, as exemplified here in the shaded case. I hope I have whetted your appetite to learn more about this research. We are always interested in learning about new potential applications, so please contact us, and thank you for your attention.